Welcome back, everyone. The Behavior Health Intervention Team would like to provide you with an overview of our grant program for the upcoming school year. We're going to do some introductions of our team members. They're each going to share what their role is on the grant. We're going to talk a little bit about the protocol framework for student referrals. And then there will be some time after the recording for Q&A with the Behavior Health Intervention Team members that are present in your building.
So at this time, we're just going to take a few moments to do some introductions of everyone who is part of the Behavior Health Intervention Team.
All right, let's start off with the USD 402 Behavior Health Intervention Team members. Starting up in the top left, and I'll have them all do a little shout out if they are present today. We have our school liaisons. Let's welcome Erin Black. She will be the Augusta Middle School and Elementary liaison. Erin, if you're here, do a quick shout out.
Hi, I'm Erin Black. I'll be working with middle school and elementary in the role of the liaison. I'm excited to be working with your kids and meeting new people and working with families in the district.
Christy Prey will be at the high school this year and will continue serving as a school liaison.
Hi, I'm Christy Prey, and I look forward to another great year being a part of the BHIP team as the high school liaison.
All right, let's move down to our school counselors, and we will start with Ariel Northern. She is at Ewalt and Robinson and is new to the district this year.
Hi, I am the new school counselor at Ewalt and Robinson, and I am very excited to get started here in the Augusta district.
Next, we have Jessica Mallon. She's not new to the district and served as a liaison last year, but will be taking over the role of school counselor at Lincoln and Garfield. Good morning, Jessica.
Good morning, Dolly. Good morning, everybody. I'm really excited for my new roles, and I look forward to a great year.
Next, we have Bryna Boldra, and she is our new counselor at the middle school.
Hi, everyone. My name is Bryna Boldra, and I'm the new counselor here at the middle school, and I'm super excited to get to know everyone. And having this resource available is a wonderful opportunity for us to grow professionally and to meet everyone in the district. So I'm really excited.
All right, next we have Alicia Bodick. She is also at Augusta Middle School.
Alicia, I think you all know me.
Next, we have Audrey New Schaefer. Audrey's not new to the district, but she has shifted over to Augusta High School.
Yep, good morning, everybody. I'm happy to get this year started. I know that all the kids in the district are excited to get back, whether they admit it or not. So looking forward to another good year.
Harmony Davis is coming back this year. She is at Augusta High School.
Good morning. This is my second year in the district, and I am the freshman and junior counselor this year at the high school, and I couldn't think of a better place to be.
Next, we have our Title I social worker who is at Garfield and Robinson. Let's welcome Julie Jones.
Hi, everybody. Good to be back this year. I look forward for a great year and look forward to seeing everybody.
All right, we have our USD 628 interlocal coach, Denise Walton. If Denise is with us, can you give us a shout out, Denise? We also have our SRO, Matt Meckel. He's not with us this morning. He has other obligations, and we'll welcome him. And then I'm the grant director, and I'm Holly Kearns now, so I need to change that, obviously. Glad to be back and looking forward to have this program in place so we can help our kiddos throughout the school year. The next group of people that work with the district for the Behavior Health Intervention Program team is South Central Mental Health. So I'm going to let them go ahead and go through their list of employees, and if they want to do a shout out, they're fine. to do so. Also, you'll see in here there is a link, which you'll have this in your agenda later today, that has a grid of pictures of the staff members. And this is updated on a regular basis, but we'll have some pictures in there of those members. All right, go ahead, South Central Mental Health.
So our first is our South Central Community Mental Health Community-Based Services Director, which is Tim Hine. You want to say hi, Tim?
Hi, guys. Looking forward to working with you all again this year.
And then South Central Community Mental Health Community-Based Services Team Lead, and that is me. I am Shelby Dawkins. I am in my 10th year with South Central and 7 years as a lead. And just below that is a list of our case management staff. We'll keep updated for everyone that they can just click on and see who is in their schools or classrooms, and also their job title, and any contact information they have will be listed in there as well. And next is our South Central Community Mental Health Clinical Therapists. We have Dr. Tricia Blatchford, Lindsay Kroger, Beth Christensen, Annalisa Skinner, Ashlyn Farrison, Susanna Schoen, and Molly Bradley. And then we have our care coordinator is new this year. His name is Michael Moshiri. And our psych assistant is Deanne Lampy.
Thanks, Shelby. All right, now what we'd like to spend a little bit of time doing is sharing the role of some of the members that, or actually all the members that are on this team. So it's really clear to you what the expectation of each of these individuals is. So we're going to start off with the liaisons, and Christy's going to talk a little bit about that.
Okay, so our role as being that BHIP liaison is really to connect, assess, and communicate. So when we connect, we're connecting with the students, with the staff, with their families, and also with South Central Mental Health. So we're kind of the ones that can go between those different vital team members. When we're assessing, Erin and I will meet with staff, we will meet with the student, and then assess where that support best comes from. So whether they would benefit from having the school-based therapy or not. And then communicate. So from there, then we would communicate again with staff, with the student, with the family, and then with our team as a whole.
All right, let's move on to counselors and our social worker. Audrey, take it away.
It's just the slide's gonna.
There we go, sorry about that.
Hey, all right. Hey, so fortunately, we have lots of professionals on this BHIP team. So as such, our counselor and social worker role just within the BHIP team are basically to provide social emotional support to all students. That's thinking in terms of MTSS, Tier 1 in our buildings. We are going to make and assist staff in making behavioral health intervention program referrals. And for kids who do not qualify for South Central Mental Health supports, we're going to assist the SIT team in making intervention plans for those students.
The next slide talks about the interlocal coach, and that is Denise Walton. As far as her role, she provides training on social and emotional related behaviors, provides support for staff in analyzing group data for academic and behavior, and brainstorm strategies, provides support regarding legalities around IEP requirements, and support staff in individual student discussions, aid in data collection ideas, and intervention implementation. Matt Meckel is our SRO, and his role in the grant is to provide, just to have that knowledge of who is being served, so he can respond to their needs accordingly, and if needed, can make or accompany home visits. I'm the grant manager, and my role really is to complete the grant on an annual basis and then try to just manage the BHIP team and make sure that we are meeting and collaborating on a regular basis and are really working together to benefit our students. The next role is the CBS team lead.
And that's me, Shelby Dawkins. My role is to supervise the community-based service staff. Organizational responsibilities, I do active problem-solving strategies, individual mental health collaboration. I help manage the staff workloads. do quality control, and employee development and growth support. I also help research, develop, and organize all of our group support systems, and I oversee the operations of the Hanger Drop-In Center, and that's our community resource for ages 14 to 21.
All right, the next slide talks about the role of the case managers, and I'll let Shelby go ahead and talk about that as well.
Sure. Our case managers help assist students in developing effective controls to help manage their mental health diagnosis. They're going to use strengths-based approach in creating student autonomy. They're going to communicate any of their concerns, feedback, and updates to the appropriate parties. They will follow the instructions given by the clinical therapist and or their lead regarding effective intervention strategies.
All right. The next role is that of the support staff from South Central Mental Health, the psych assistant, and the care coordinator roles. Shelby, you can do this one too.
Do you want to go back to the clinical support?
Oh, I'm sorry, I missed one. All right, clinical therapist, my bad. Sorry about that.
No problem. The clinical therapist provides integrated mental health treatment for the students and their families. They assist students in overcoming behavioral, emotional, or social problems that might interfere with success at school and at home. They're going to help students reduce disruptive behavior, improve self-monitoring skills, and increase healthy engagement at school, at home, and in the community.
All right, now we can move on to the support staff.
Sure. The psych assistant role is going to receive the referral from the liaison and help contact the parent or guardian to schedule an intake with our clinical therapist. They were going to collect insurance information, gather the mandatory releases, and clinical documents from the parent or guardian. They will facilitate assessments and initiate the clinical intake to evaluate student and family needs. From there, the care coordinator will actually continue that support and relationship. They assume that advocacy role for the client and family. They're going to maintain direct lines of communication with all team members. They will coordinate treatment planning to include the progression of their goals, objectives, the services they're receiving, their strengths and needs, and a crisis plan. They're also going to ensure that all state and agency guidelines are followed.
Thanks, Shelby. All right, I'm going to have Audrey just read through what the overview of our program.
Yep, the goal of our BHIP program is to provide treatment and track the behavioral health needs of USD 402 students. This goal includes improving the social emotional wellness and outcomes for all students. USD 402 and South Central Mental Health will strive to meet the mental health needs of students by sharing and collaborating on this project.
All right, Ariel, why don't you go through the program outcomes at this time?
This program is designed and is proven to improve behavior, improve grades, increase stability at home, increase school attendance, decrease dropout rates, and increase graduation rates.
All right, Christy's going to share just a little bit of the evidence from last year and the effectiveness of the BHIP grant program.
Okay, so within the BHIP team, we meet either weekly or monthly as an entire team, and we do, as liaisons, have to provide evidence the best we can. And so some of that evidence, as far as attendance and grade improvement, is pretty easy to track. The others, as far as internalizing and externalizing behavior, we meet with different staff, whether it's counselors, teacher, and the clinical therapist, just to assess their improvement. And as you can see by the evidence that we provided last year to the SAE, I'm very proud of this team and how we were able to support USD 402 students.
Right, so on this slide, you will see an information flow chart. And really what this is it takes staff members through the process of from point A all the way through point B in regard to students that you feel like might need to be referred. So this will be something you may want to come back to and read, but I'm going to have Harmony go ahead and read through this so you have a good understanding of what the protocol is.
So the first step is for school staff to communicate with their concerns with the child, with the family and the counselors. One of the things we ran into last year was we realized that the first time parents were being notified that there were any concerns was when the liaison was calling them. So this year we would really like if you would keep that communication line with the parents open so they know what's going on. The school staff can use a Google form to refer a student. The links to those are on your right-hand side of the screen. However, if there is an immediate risk of harm to self or others, we need to follow the emergency protocols and not follow the flowchart steps. That can come later, but the first thing is to make sure that our students are safe. After the referral is made, the school liaison will review it, complete a screener, and administer a behavior assessment. Then the referral, screener, and assessment data is reviewed by the school liaison and clinical staff to determine if the child is eligible for clinical therapy or case management. If the child is not eligible, the school liaison will meet with the SIT team to develop a student improvement plan and enter that in Panorama Student Success. Support for the student will be provided by USD 402 staff. This might be the liaison, it might be counselors, social workers, teachers, paras, really anybody that works in the district. The school liaison will connect with the parent and guardian and share their concerns, information gathered, and support services that will be provided. They will inform appropriate staff regarding the student improvement plan. Behavioral intervention team members will provide appropriate professional learning for different interventions and strategies you can use in the classroom or other school settings. The school will implement the student improvement plan and the school liaison will review that plan each semester. If the student does qualify for clinical therapy and case management, the school liaison will connect with the parents or guardians to share concerns and information gathered, and then an intake meeting with the clinical therapist is scheduled by the South Central Mental Health Psych Assistant. The clinical therapist will complete the intake, which is a medical assessment. They will complete a treatment plan for the student. The child will receive services through South Central Mental Health and possibly through the district as well. The Behavioral Health Intervention Program will enter the information into Panorama Student Success. The school liaison informs appropriate staff regarding behavioral treatment plan. Again, the behavioral intervention team members will provide appropriate professional learning and for strategies and supports in the classroom and under their school settings. South Central Mental Health will implement the treatment plan and review it each semester.
Thanks, Harmony. All right, Erin, do you want to share the school liaison schedules real quick?
Definitely. So Christy's schedule at the high school will be Monday through Fridays, 12 to 3:30, and myself will be at the middle school Monday, Wednesday, Friday, and at the elementary schools as well from 8 to 3:15. Will is out of office at the middle school Monday through Friday, and I will be at the elementaries as needed on the days when I am not otherwise obligated.
All right, here's a little bit of information about therapy and case management services. As you know, we're all kind of in COVID mode right now, so this is just a brief description of what the services might look like at this point in time. School-based mental health services during COVID restrictions will consist primarily of collaboration and coordination of services between the school staff liaisons and South Central Mental Health. Location and delivery of medically necessary services will vary depending on individual needs of students. Once COVID restrictions are lifted and we're in a stable situation, school-based mental health services will return primarily to face-to-face on-campus delivery of medically necessary services in addition to collaboration and coordination of services between the school staff liaisons and South Central Mental Health. Location and delivery of services will vary depending on the individual needs of students. All right, the very last slide is just a Q&A, and all of you will have people in your building, should have someone on this date, and if not, please feel free to email or visit with them about any questions you have regarding the Behavior Health Intervention Program. Have a great week, everyone.